Good afternoon. This is Shawn McIntosh, Program Manager at the American Public Health Association's Center for Public Health Policy. I'd like to thank you for joining us today to hear about the importance of planning for sustainability to keep the momentum going in your projects. As most of you know, Plan4Health is helping communities across the country funding work at the intersection of planning and public health. Anchored by members of the American Planning Association and the American Public Health Association, Plan4Health supports creative partnerships to build sustainable cross-sector coalitions. When the Plan4Health proposal was crafted, we envisioned that coalitions across the country would fully integrate planning and public health principles to build a culture of health in their communities. Our hope was that cross-sectoral collaboration and a health in all policies approach would become second nature. We are so happy to see that happening at the community level, and it is essential that your coalitions find ways to sustain your momentum, even in times of low or no funding. Today we are going to hear about strategies that you can use to prepare your coalitions for long-term sustainability. Our moderator will be Evelyn Kelly, Senior Program Manager at the Institute for Public Health Innovation. As a Senior Program Manager at the Institute for Public Health Innovation, Ms. Kelly works with a variety of sectors and stakeholders, including executive-level leadership, elected officials, health departments, planning agencies, police departments, and community-based organizations, among others, to implement policy systems and environmental changes aimed at improving the health of the community. Ms. Kelly has more than 14 years of experience as a public health practitioner and researcher and has engaged in a variety of public health efforts ranging from community planning and capacity building to health policy development and advocacy. Her professional interests include community health workers, racial justice and health equity, community organizing and advocacy, food justice, and the promotion of physical activity. Ms. Kelly earned a Bachelor of Science in Health Promotion from American University and a Master's of Public Health in Physical Activity and Public Health from the University of South Carolina. Before we begin, I would like to let you know that we are in fact recording the webinar. And with that, I will introduce you to Ms. Kelly.
Good afternoon, and thank you for joining us today for our webinar, Plan4Health Grantee Sustainability. I'd like to thank the American Public Health Association and the American Planning Association for inviting us to share our insights and experience regarding sustainability planning. Just to provide some background on who we are, as the official public health institute serving D.C., Maryland, and Virginia, IPHI believes our region health systems and policies for all people to thrive and be healthy. We cultivate innovative solutions, provide expertise and support, and collaborate with a range of partners from health departments to local governments, universities, CBOs, and others to help address public health issues that are identified by the communities we work with. Our work is strongly focused on addressing health inequities and assuring that all communities have the opportunity to achieve better health and quality of life. For the next 50 minutes, we will highlight our lessons learned around sustainability. The overall purpose of the webinar is to define sustainability and provide an overview of the key steps in the planning process, share lessons learned from real-life examples, and respond to your questions and comments concerning sustainability planning. This afternoon, you will hear from 3 panelists who will highlight examples of their work as well as action steps that you can take as you begin your respective sustainability planning process. Our first panelist is Sydney Daigle. Sydney currently works as the program coordinator for the Prince George's County Food Equity Council and serves as a consultant on IPHI's Food Policy Charter project. Sydney has over 5 years of professional experience promoting and implementing strategies to strengthen localized food systems and improving underserved communities' access to healthy food. Sydney previously served as a South Carolina Department of Education Farm to School and Fresh Fruit and Vegetable Program Coordinator. She loves getting wonky about agriculture and nutrition policy, cooking, but mostly eating Southern food, and doting on her 2 dogs. Our second panelist is Marisa Jones. Marisa is a program manager at IPHI and directs the day-to-day activities and strategic planning for the Healthy Eating, Active Living Cities and Towns campaign for the Mid-Atlantic. She provides technical assistance to local elected officials and staff on a number of policies that make it easier for people to eat better and move more. Marisa's previous health experience ranges from conducting research on immigrant access to health and social services in Somerville, Massachusetts, to public health outreach and on-site monitoring of chronic diseases in underserved neighborhoods of Quito, Ecuador. Marisa completed a Bachelor of Arts in Community Health and Political Science at Tufts University. Marisa is a bilingual in Spanish and English and is an active volunteer with Back on My Feet, an organization that uses running as a means to build self-sufficiency among people experiencing homelessness. Finally, our third panelist is Dr. Mike Royster. As Vice President of IPHI, he represents the Institute on the Richmond City Healthy Corner Store initiative called Get Fresh and participates in policy development, evaluation, and fundraising to support the initiative. In addition, Mike is developing additional initiatives to support priorities within the region, ranging from providing training and technical assistance for organizations interested in incorporating a health equity lens into their work, to supporting community health needs assessment and community health improvement planning. Prior to IPHI, Mike was the director of the Virginia Department of Health Office of Minority and Health and Equity. Mike completed his undergraduate training at the University of Virginia and his medical training at Duke University. He completed a residency in public health and general preventive medicine at Johns Hopkins School of Public Health, where he also obtained a master's degree in public health. So let's begin with defining sustainability. There are multiple definitions of sustainability used by funders, researchers, and community-based organizations. For the purposes of this webinar, we will use a definition provided by the CDC, which defines sustainability as a community's ongoing capacity and resolve to work together to establish, advance, and maintain effective strategies that continuously improve health and quality of life for all. So it can be daunting to begin to make decisions about how to move forward with your program after the grant period ends. These decisions have implications for the community that you serve, as well as your program team and staff. This is why sustainability planning is so important. This is why it's also important to engage staff, consultants, partners, or advisory board members in the process. I'd like to offer 4 steps that you can consider as you move forward in your respective sustainability planning. First, I recommend that you begin the process with assessing what has been accomplished. This would include reflecting upon what has changed since you initiated the project, whether new partnerships were formed or strengthened, if new capacity was created, and how about policy changes. These are often referred to as your long-term impacts. There are multiple ways that an initiative can impact a community long after services have been discontinued. Secondly, based on your lessons learned and accomplishments, you'll have a better sense of what worked and what elements should continue and what you can build upon. Essentially, you want to answer the question, now that you know what you know, how would you move forward with the implementation of your program or initiative? I remember when our 2-year community transformation grant from CDC came to an end, and I had to begin, or near an end, and I had to begin to work on my sustainability plan. At that time, it was a little over a year, and I felt I was finally making traction. Now, all of a sudden, I had to stop and think about the next phase. However, once I sat down to begin this process, I felt a sense of relief because now I was looking at the program with an opportunity to reshape it with my own lens and not under the parameters of my funder. Thirdly, move forward. So after you figure out what elements of your work will continue, you'll need to identify what you need to move forward. This could include assessing program structure such as staffing and management, as well as collaboration among partners in order to determine what changes may be needed to achieve maximum efficiency. This can be a difficult conversation because you may have to make hard decisions about how many and which staff will be needed to support the activities that you have prioritized to sustain. You should also assess the roles of partners, asking whether you have maximized their assets, whether you have the right partners at the table, or whether the coalition needs to continue or it can be embedded within a program that is institutionalized. One of the lessons learned from our community transformation grant regarding our leadership team is that although it was the first time such a cross-sector high-level team was formed to discuss public health concerns, it was not sustainable beyond the grant because it was not embedded within an infrastructure that would remain regardless of a grant or who was in office. The other important component is developing a budget. So you have a clear sense of how much funding you need, and you begin to discuss how you will sustain the work. Having a clear idea of the cost of sustaining your prioritized activities is an essential part of sustainability planning. Shortly, I will touch upon the importance of diversification of funding. As you move forward with your process, you should note that sustainability does not necessarily mean that the activities or program continue in the same form as originally conceived, funded, or implemented. Programs can change over time to adjust to the fluctuating levels of support and the needs of the community. Organizations may start with one approach but end up sustaining a different model after implementing it in the community. Thus, you should consider assessing the levels of support, and those would include asking the questions, are they still the same? Or have they increased or decreased? I would also include political will under this strategy. Do you still have the high-level support? We know that turnover can be challenging, and sometimes if those original champions are no longer part of the process, you can lose momentum. You should also assess the needs of the community as well as your organizational capacity and whether that has changed. By the end of this process, your sustainability plan should inform decision-making about how to move forward with your program after grant funding and clarify the importance of your program in the community. By the end of the process, you will have determined the activities to be continued, know the cost for the continuing these activities, and have a funding strategy that will realistically support your activities for the years to come. Now let's briefly talk about funding. I know when you think about sustainability, many of you will immediately think about this. Diversifying funding sources is key for sustaining programmatic activities. In the interest of time, we will not be able to go into detail regarding this area. However, we'd like to emphasize that listed in the chart highlighted, you see a list of range of methods for which you may consider. I would recommend considering one of these strategies that you would like to pursue. And when identifying this strategy, consider which mechanisms are best suited for your organizational capacity, current and potential partnerships, and plans for programmatic needs. You should also keep in mind that your partners can realistically play a role in the long-term support of your prioritized activities, as they can play a role in supporting your work and leveraging additional opportunities for funding. Each of our panelists will be focusing on the following key sustainability strategies recommended by the CDC. These include recruiting program champions and partners, making organizational or structure changes, and engaging in community efforts. As mentioned, we will not be covering diversifying funding. The first strategy that we would like to share with you is recruiting program champions and partners. When you formed your leadership committee and Plan4Health coalition, you took the first step toward this sustainability strategy by identifying the key people who would help you advance the work. We are highlighting this as a sustainability strategy in order to get you to keep thinking of new partners and champions you can recruit to keep the work progressing after your funding ends. We will hear an example of how a grant-funded initiative has been able to leverage the partnerships and support of champions it garnered during the funding period to keep the work moving forward even after the funding ended. To present on this topic, we have Cindy Daigle, the coordinator of the Prince George's County Food Equity Council.
Hi, my name is Cindy Daigle. Thanks for the opportunity to speak today. As Evelyn mentioned, I'm the coordinator of the Prince George's County Food Equity Council, a local independent food policy council for Prince George's County, Maryland. For those unfamiliar with food policy councils, they are at their most basic, a group of representatives and stakeholders from many sectors of the food system, working to develop and advance innovative solutions that build food systems which spur sound economic development, improve public health, and ensure environmental sustainability. Today I'm going to share a bit about FEC's membership and work, especially as it relates to how we built relationships and the systems we needed to transition out of CDC funding and into a more sustainable council. FEC is and was incubated within the Institute for Public Health Innovation and launched with funding support from their CDC Community Transformation Grant. Before FEC's launch, IPHI worked behind the scenes with partners to advocate for a county council resolution to endorse the formation of our council and our efforts to advance health equity through food system change. This resolution recognized the Food Equity Council as the food policy council for the county and granted us an annual meeting to present our findings and recommendations. This was critical for us. It gave FEC credibility in the county before we even launched and made key decision makers aware of who we were and what we intended to do. As you can see from the slide, we launched on Food Day 2013, so we're just over 2 years old, and our CTG funding ended about a year after we launched. Our Food Policy Council is comprised of 22 local leaders, both in their communities and fields, who represent farms, food retailers, schools, universities, government agencies, nonprofits, and one very valuable local elected official. Our members were selected strategically based on their professional and personal accomplishments and are broadly representative of the food system we are trying to create. FEC is structured so that our members serve on work groups, and this is really where the bulk of our council's work gets done. They sit alongside residents and professional stakeholders and research and develop action plans for specific food and farm policies in the areas that you can see on the right-hand side of the slide. These work groups were chosen after a strategic planning process where we did a lit review of the reports, articles, and other media published about the attitudes towards and the status of the county's food system. Strategies were generated by work groups based on that lit review and put through an evidence-based tool to prioritize them. It was important to us that we identify low-hanging fruit and easy wins early on. It allowed our members to accomplish something tangible in their 2-year term as volunteers, and it also reinforced our credibility as a food policy council. We were able to claim successes early on in our existence, and this was helpful in building allies and, of course, when we were seeking funding. Following selecting work groups and strategies, we held internal leadership elections. This ensured that there were council members accountable for carrying out the action plans we developed as a group, and also created a go-to internal champion in each work group that could be a public spokesperson and devote some of their organization's internal resources to advancing the work. We've had a number of accomplishments since we launched. I'd like to emphasize most of these, especially those concerning policy change, took place in our second year after our CTG funding ended. Policy change is a very slow process, as many of you on the webinar today know, and we frankly underestimate the amount of time it takes to build the relationships necessary to drive the change that we wanted to see. That said, I do believe the strategic planning work and the relationship development that we did in our first year really started to pay off in our second year and contribute to the flush of policy wins that we had. I'm going to walk through 2 examples of how we accomplished our policy priorities and outline the strategies we used to build relationships and leverage our internal resources to advance our strategies. Bringing healthy food trucks back to Prince George's County has been on our policy agenda since we first launched. In Prince George's County, food trucks and mobile farmers markets were previously not allowed on public right-of-way. Our council did extensive research on existing regional models and best practices from across the country on mobile food vending. Luckily, one of our Food Equity Council members, who served as chief of staff to a local county council member, was elected to take his seat. This was a huge win for us. One of her first big policy pushes was to bring back food trucks to the county, and since she had been involved and was familiar with our work, she invited us to sit on the working group that drafted and advocated for the legislation. We were able to bring extensive research to the working group and potential strategies that were well suited to the county, and this really helped us establish our credibility within that working group early on. We also started developing relationships with organizations like our local food truck association, since we had been doing research previous to the launch of the working group, and that was really helpful in driving our goals for the bills. We were interested in seeing mobile food vending legislation for the county that both provided mobile farmers markets to operate in areas that had issues with healthy food access, and also provided food trucks that would sell healthy fare. Since we had existing and fairly strong relationships with at least 2 of the co-sponsors for the mobile food vending bills, they acted as allies to introduce amendments to the bills that reduced burdensome regulations on mobile farmers markets and included language to create nutritional guidelines for food trucks participating in the program, both of which were very important to our council. To my research, this legislation is the first in our region to explicitly cite increased access to healthy food as a goal for mobile food vending. Though this is a popular strategy nationwide, this was trailblazing legislation for our region. Next, we're going to talk about the community eligibility provision. This is a program that provides universal free breakfast and lunch in high poverty schools. The Food Equity Council worked closely with one of our member organizations, a leading state anti-hunger advocacy group, to reduce the barriers Maryland schools face in electing the community eligibility provision through advocating for a bill called the Hunger-Free Schools Act of 2015. Through this partnership, we advocated and testified in support of the bill, and once it was signed into law, we began advocating at our local level for our school district to select schools to participate and elect the community eligibility provision. Through multiple meetings and conversations with key allies, we were able to connect with our local superintendent and explain the importance and benefit of the community eligibility provision for local schools and the potential positive impact on student learning outcomes. As a result of our and our partners' advocacy, our superintendent worked with our local food and nutrition services director to select 9 schools to elect the community eligibility provision. Starting this school year, more than 4,000 students in those 9 schools receive free breakfast and lunch through this provision. So to recap, these are the strategies we used thus far to successfully transition out of our CDC funding into a more sustainable organization which could make some policy impacts. We cultivated strategic internal and external champions for our strategies. We built credibility amongst stakeholders and key decision makers as early as possible and maintained it through easy wins while we built up to more ambitious strategies. And finally, we developed strong relationships and buy-in in our work through identifying and actively working on mutually beneficial goals with our partners. All right, and I'll pass it back to Evelyn.
All right. The next strategy we'd like to highlight is making organizational or structural changes. What we mean by this is that you are creating the conditions in which your progress can continue even after your funding ends. It includes establishing this change process as a routine part of your business or the way your city region works. It means you work to align policies, procedures, and practices to maintain the work. These systems-level changes support your work even after funding ends. As a real-world example of making organizational or structural changes, we will now hear from Dr. Mike Royster, Vice President of IPHI, about his experience working with the City of Richmond, Virginia, on the implementation of a Health in All Policies framework.
Thanks, Evelyn. Hello, everybody. Just to give a little background on Health in All Policies, or HIAP as we sometimes call it, it's based on the understanding that our health starts long before we need to see a doctor. It starts in our homes, neighborhoods, schools, and workplaces. And as we know, these factors are outside of the realm of influence of public health and medical professionals. And so the HIAP framework then really attempts to incorporate health and social equity considerations into policy, programmatic, and service delivery decisions across all departments, offices, and agencies. And in this case, in the City of Richmond, Virginia. This effort grew out of the Mayor's Blue Ribbon Health Policy Commission, which had recommended previously the inclusion of health and social equity into city's decision-making and to establish an interdepartmental team to oversee this effort. So our process of institutionalizing these recommendations from the Blue Ribbon Health Policy Commission in Richmond began with a small team that formed as a part of the National Leadership Academy for the Public Health. Initially, it was the Deputy Director of the City Health Department and myself who began discussions about how to potentially use this opportunity to advance health in all policies. And recognizing that this is really an effort that spans all of local government and all that's done, we wanted to identify team members who strategically could help support that effort. And so we engaged a member of the school board who was new to the school board and had come aboard as a strong advocate for the well-being of children. And we felt that this link, the clear link, one, between schools as a primary place for many health promotion interventions and for the opportunity of creating healthy environments, was a key partner. And so this member of the school board agreed to join our group. We also wanted to approach someone within the city government with a similar level of influence and talked initially with one of the city council members who has a strong background in health and was very interested. She unfortunately did not have the time to join us, but we were able to identify someone within city government who knew the inner workings of the city within the Office of the Deputy Chief Administrative Officer for Human Services to be a part of our team. And we maintained close contact with that city council member who was not able to be on the team, and she served as a key champion as we moved forward. Around the time that we were beginning this Health and All Policies team, the city was also establishing an Office of Community Wealth Building to implement the mayor's priority around reducing poverty in the city. And clearly we recognize that this is another key opportunity to collaborate and build and identify champions because of the strong link between poverty and health. And so through this process of engaging these team members, we then began the strategy of reaching out to the city council. We had really two levels of efforts that we wanted to focus on, one being legislative, and I'll talk a little bit more specifically about the legislation we were looking for around HIAP, and then the implementation aspect. And so within legislation, we clearly wanted to build relationships within the city council. We had one strong advocate already from the city council member who was very interested in joining our team. And so she was able to help us navigate through the city council in terms of identifying which committees we needed to present to, as well as identifying the priorities of individual city council members, so that when we individually approached each of them to share our vision for health and all policies, we were prepared for the conversation. And fortunately, our other team members, particularly from the health department, had strong relationships with city council, and so we're able to build on those relationships also. And so we, in the process, developed talking points to explain health and all policies to the elected officials and why it was of value. We had one-on-one meetings with them, and we also engaged some community partner organizations to let them know that this process was going on and to explain how it could be of value to them. And we felt that that could be valuable down the road if needed. Fortunately, we were able to gain strong support from all the city council members by recruiting some of the key champions that I mentioned. And as a result, we were successful in building the political will for the passage of local legislation in the form of a resolution and a policy establishing a health and all policies framework for the city. And this framework included a focus on health and social equity across all local government policy, program, and service delivery. It also identified the need to develop an interdepartmental team, which has come out of the Blue Ribbon Health Policy Commission. It established the need for ongoing metrics, as well as an annual report to report back to City Council and the community at large as an accountability measure. And so as I mentioned, we really focused on two levels, legislation and implementation. I talked a little bit about legislation, and now I'll talk more about implementation, but you'll see that there's overlap because a big part of our strategy was really thinking of ways that this HIAP approach really connected with work and priorities that already existed within the city. And so this slide kind of exemplifies how we thought about strategically how to embed health and all policies both within the legislative approach and ultimately within implementation. I mentioned in terms of city priorities, the mayor had established the Blue Ribbon Health Policy Commission, and when we first started, we were very careful to link our work to this commission's report so that there was an understanding of why we were even suggesting what we were suggesting. The mayor's Healthy Richmond campaign was really the implementation arm of that policy commission. And so as we move forward through our partner who worked within city government and who oversaw the Healthy Richmond campaign, we were able to, again, have this health and all policies work come under the umbrella of the Healthy Richmond campaign. The main priority within the city at the time and currently is poverty reduction, and the mayor had developed a task force with this focus and the Office of Community Wealth Building, which I mentioned previously. And so we were very eager to work with them and to identify common ground so that there was clear connection between our work and the work to reduce poverty. And fortunately, the staff of the Office of Community Wealth Building very much saw the connection. And their focus on education, transportation, job training, and housing are all key social determinants of health as well. And so we were able to build a strong relationship with them and to align the health and all policies work with that priority. And finally, the city was in the process of developing a strategic plan when we started this work. And again, felt like this was a great opportunity to connect with what the priorities are in the city, and had conversations with the manager of the strategic plan, and she was able to very clearly see the links between what we were trying to do and what the city was trying to do through the strategic plan. And in fact, as we talk about terminology, we were able to really identify that many of the things that we talked about from a health lens, the city was committed to from, as they called it, wanting to become a Tier 1 city, which is a premier city and recognized for the quality of life. These factors are really things that we were talking about, but in different language with health and all policies. And so through conversations with the strategic planning folks, we were able to kind of begin to use both types of language together and to, again, link the health and all policies work with an ongoing priority within the city around the strategic plan. In particular, the strategic plan has 7 focus areas, and through our partnership with the manager of the strategic plan, we have developed the integration of health and all policies language into the strategic plan, as well as health and all policies metrics. And we've also decided to utilize those existing focus area groups within the plan as the interdepartmental team that will oversee the implementation. And we've, again, identified a different level of champion within each of those groups that will be the leader of incorporating health and all policies into the strategic plan focus areas. One other area of kind of terminology that we just kind of came up with earlier this week in a meeting, recognizing that poverty reduction and wealth building is really the top priority for the mayor, we started to throw around the language of not just health and all policies, but wealth and all policies, and are now thinking about how we can use that framing to get further buy-in for the work that we are proposing. And then clearly a lot of what we've been talking about aligns with the city's values. Certainly the city has shown a strong interest in equity through the poverty reduction efforts. Through their strategic plan, they also talk prominently about increasing government efficiency and increasing collaboration. And so basic to the principles of health and all policies is the idea of equity, efficiency, and collaboration. And so again, we've been able to tie health and all policies and how it works to how it can support the city's values. In addition to this, we recognize that training is really critical for government leaders to implement this health and all policies framework. And so we've been working to develop a 2-day workshop for city leaders, including the chief administrative officers, city council, and directors of the various government departments, including the school system. The workshop will provide city leaders with the actual tools and understanding they need to implement HIAP in day-to-day work and decision-making, and to break down silos. This workshop was actually scheduled to take place earlier this month, but has been postponed until December to assure that we have the attendance of the key leaders that we really want to be there. And then within the training itself, we will assign participants to groups across different departments and have them work on case studies that are currently relevant to the city and are current priorities to the city, so that the health equity impact tool that we have adapted can be utilized, and staff can see how this health and all policies framework can actually benefit them in doing the work that is already the priorities within the city. And we're also going to be developing other tools in a web-based toolkit to be further support for the government officials as they move forward in terms of integrating the health and all policies and lens into their decision making. So in summary, there's a number of actionable strategies that we've been working on that are applicable regardless of the content area that you're working on. Again, the identification of champions at the various levels was really important and is really important. And really thinking about what our goal is and then being able to identify champions that have that same goal in mind and being able to work with them to advance it. I also talked about aligning strategies and goals with existing initiatives and priorities, which we really did very deliberately and thoughtfully to be integrated into what the city already prioritizes, and that carried over to the language that we used as well. I talked about training, which is really critical so that whoever's implementing whatever the priority is, that they know how to do it and have the resources to do it. And oftentimes it's not just one training event, but it may be ongoing training, which we anticipate as well. We're also recognizing that it is going to be valuable to have staff that can devote their time to coordinating the ongoing implementation. I think over time there's certainly the potential that the implementation could wane if there's not those champions who have the time to really keep things moving forward and to focus on ongoing training and to continue to connect the work to existing priorities. And then finally, engaging grassroots and community partners, I think, is really important. We were fortunate in that we were able to gain a lot of support within the governmental structure. At the same time, I think that as implementation goes on, having grassroots support and the push from the community at large to continue this effort is going to be a key additional strategy around sustainability. And so with that, I'll turn it back over to Evelyn. Thanks.
Thank you, Mike. All right, our third and final strategy that we'll highlight today is engaging in communication efforts. Getting the word out about the work you've achieved is a critical component of sustainability. If people do not know about the change that has been made, how do they know that it must or should be sustained? Communication efforts serve many purposes: attracting new funders, building new partnerships, attracting media attention, and preventing future cuts or threats of elimination. To share an example of how a city uses communication efforts to both build upon its success and prevent progress from being undone is Marisa Jones, who will share the strategies the City of Annapolis has used to advance its Healthy Vending initiative.
Good afternoon, everyone. So as the manager of the Mid-Atlantic Healthy Eating, Active Living Cities and Towns campaign, it brings me great joy to get to share with you the change that one of our cities has made and been able to sustain over, at this point, over almost 4 years. So in 2012, IPHI's HEAL, Healthy Eating, Active Living Cities and Towns campaign began working with the City of Annapolis to identify specific actions the city could take to improve opportunities for physical activity and healthy eating. Spearheaded by the Community Health, Recreation, and Aquatics Supervisor, the city decided to use its procurement power, or purchasing power, to offer healthier snacks and vending machines on city-owned and operated property to make healthier choices available to employees and residents. Staff within the city's rec and aquatics facility felt that it was incongruous to be spending so much time planning for and providing high-quality physical activity opportunity to the residents of Annapolis, but then offering only high-fat, high-sugar snack options in park and recreation facility vending machines. Annapolis worked with its vendor to establish minimum nutrition standards for the snacks and beverages offered in vending machines on city property. This change was met with mixed results. Many busy parents appreciated the ability to grab a healthier option while on the go between a child's swim class and soccer practice, though some people were disappointed that their Cheetos or Honey Buns had been replaced and tried to undo the change. Fortunately, Annapolis had planned from the beginning how they would sustain this change. From the beginning, Annapolis began collecting data on the revenue collected from each vending machine before and after the healthy vending intervention. Annapolis uses these data to tell the story of the successful healthy vending intervention. Opponents of the healthy vending intervention try to make the case that the city is now losing money because people aren't purchasing healthier snacks, yet the data show that the contrary is true. Sales have stabilized and actually increased greatly since switching to healthier snacks. The data in Annapolis show that although dissidents think that this is causing the city to lose revenue, the healthy vending intervention has actually been a boon to the city. Using data as an effective defense mechanism against cuts and helps make the case for expanding healthy vending machines to all city buildings, which Annapolis has now done. However, not all people respond to charts, graphs, and Excel spreadsheets. Staff in Annapolis have been quite savvy at using multiple communication strategies to share the success of this initiative. In the city of Annapolis, they use the revenue from vending machines to fund scholarships for residents to attend summer camps or recreational programming. So rather than just talking about the amount of money they've earned, they can tell the story that as a result of switching to healthier vending options, now more residents have received scholarships for recreational programming. That in turn attracts positive media attention. People connect with that more than they connect with the numbers in a graph or on an Excel spreadsheet. It sounds good to hear that the city is increasing scholarships and supporting residents to be physically active. Because of this work, staff in Annapolis have been invited to present at multiple conferences and workshops and used this initiative to advance in the First Lady's Let's Move campaign, which has garnered them invitations to the White House on 2 occasions. This storytelling and communications work helps secure the future progress and sustainability of this work. The city doesn't want to undo work it has attracted positive media attention for. And now they're using the success of the Healthy Vending Initiative as an example to expand to improving other aspects of community health and wellness. I also want to share this photo of 2 of the city's vending machines, which demonstrate the branding the city has done for its Healthy Vending Initiative. By wrapping the vending machines in a beautiful photo of the city and using crabs, a very Annapolis motif, in the point-of-sale nutrition education, residents connect with this effort as a unique initiative for the city. It makes people connect to the effort and think about healthy eating as part of their city identity. When we think about how the city of Annapolis has been able to sustain its work, even in spite of people actively trying to undo the progress, we see that communications efforts have been an integral part of the sustainability of their Healthy Vending Initiative. We've identified some of the key strategies that you can pursue to use communications efforts to sustain your work. We know that you are doing communications as part of your Plan4Health work, so think about how you can build upon what you're already doing using some of these strategies. One of the main suggestions that we have is to collect data along the way and also to use it along the way. Too often, we see programs or initiatives collecting data for the sole purpose of turning it into the funder in the form of a final report. Think about ways that you can use these data you're collecting to tell a compelling story. In Annapolis' example, we see how they didn't just talk about the amount of revenue generated, which in itself is a compelling story, but instead they tell the story of how, as a result of increased revenue, they've been able to provide more scholarships to residents for physical activity. This is what I mean by present data in a way that people understand. Another strategy is to connect to larger efforts. The strategies that you are pursuing as part of your Plan4Health grant may provide you the opportunity to connect with similar efforts happening statewide or nationally. For example, many strategies that integrate planning and public health may help your community achieve recognition within the First Lady's Let's Move campaign, or be part of the National Complete Streets Coalition's annual scoring of the best complete streets policies. Learn if there are initiatives larger than what you're doing locally, join them, and then tell that story. Really, the most important piece here is telling the story. Make sure people are aware of the work that you're doing. The more people know about it and can see how it is impacting their life and the life of members of your community, the more you safeguard it from cuts, you can gain new partners to the work and raise the profile of your work to attract new funding. As we saw with the city of Annapolis, it's not enough to have just one way to tell the story. If Annapolis had relied solely on data, they would be missing out on connecting with residents and the media who are less interested in the amount of revenue generated by vending machines than on how it impacts their community. Think about the ways that you can reach different audiences through diversifying the way you tell the story. It's important to incorporate photos and videos into your storytelling. As you progress with the work that you're doing, make sure that you're taking photos, getting quotes, and using those to help tell the story. Branding also plays a big role in communications as well. Creating a logo or web page helps give your effort a boost in credibility. It communicates that you don't think your work is going away anytime soon. You saw in Sydney's presentation that the Prince George's County Food Equity Council has a logo that makes them look very official and adds to their credibility. When thinking about establishing your brand, identify unique aspects of your initiative to create a compelling and memorable brand. So with that, I'll turn it back over to Evelyn.
All right, so we have come to the conclusion of our webinar, and at this time we will open it up to any questions or comments that you may have for us. Sean and Ann, would you like to kick us off? I believe you have been collecting some questions throughout the webinar.
And if other folks have questions, please go ahead and chat them into the Q&A box. We would be happy to answer any of those questions. So one of the questions that we see coming in is for Sydney. So Sydney, can you tell us about, sorry, I'm scrolling up. Can you tell us about how you initiated contact with the county council members that you worked with on the food truck legislation?
Yeah, I'd love to. So I think I mentioned one of the county council members is actually an FEC member, one of our Food Equity Council, Food Policy Council members, who then became a county council member during her term as a volunteer with us, which was a huge one. But the other county council member that we worked with closely, we had initiated contact with her in order to support a previous policy. So she had created legislation to provide funding to farmers markets to accept SNAP, food stamps. And unfortunately, after this legislation passed through county council unanimously, it was defunded. So we were devastated. We sat on the advisory committee for this particular piece of legislation, and we're excited to see it implemented. So we connected with her and started trying to organize a coalition to support that farmers market bill, and then she signed on as a co-sponsor for this food truck hub bill. So luckily our relationship and our partnership with her built on itself, similar to what Michael described in his presentation with their partners. So I think that's often how these things happen. So it's never too early, I would say, to start establishing partnerships with key decision makers.
Sydney, can you tell me, was there any pushback from the county council that you had to navigate?
Yes, actually I would say we had significant pushback on the food truck hub legislation. There was, previously we had food trucks in our county about 5 years ago or so, and then they were kicked out because there were some issues with crime, with litter, and there was a perception in the county that food trucks kind of brought, negative, food trucks had negative associations, quite frankly. So we had to work with our county council members that were not on board with this legislation to address those concerns and the concerns of residents. So what we ended up doing as a working group drafting this legislation was we introduced yet another bill that created some safety guidelines and some accountability measures for participating food trucks. So that answered those concerns, and really we left with this legislation in a better place than it would have been if those county council members hadn't been vocal about their reasons for pushing back.
That's great. I think relationships really are super important. Funding is something that was mentioned as well that we really didn't go into here, and we will go into in another webinar. But Marissa, I wanted to know, do you have suggestions for how to implement communications efforts on no or low budgets? Because a lot of coalitions will have no or low budgets to continue on their work.
Yes, absolutely. So in this day and age, we're very fortunate that communications has become a more democratic and open process. So there are a couple of key things that I would suggest to folks who want to engage in communications efforts but don't necessarily have line items in their budgets left for this. So the first and obvious answer is taking to social media, establishing a Facebook page, getting some photos up there, some quotes from people from different activities or events, sharing your progress, inviting people to like your page. You can also, when I talked about branding, you could also create a dedicated hashtag that when people engage with whatever change is being made as part of the Plan4Health grants, whether it's a traffic calming pilot or using SNAP benefits at the farmers market, that there could be a dedicated Twitter hashtag for your community's initiative to really raise the profile. Another thing is that you have the ability, you can pitch your story to local media. You could write an op-ed and try and have that published. But then something else that I think people don't often think about is that I imagine that most of you are working in specific jurisdictions, whether that's a city, a town, a county, and most local governments have their own media channels. So many of them have newsletters that either go out virtually or there are still paper newsletters that go out. So having an article about your initiative in that newsletter. Most local governments these days have their own social media pages, so maybe you don't want to start creating your own page for your initiative, but working with your jurisdiction's communications office to have them feature some of your work. And then also local access TV. If you have an event coming up, or like a ribbon cutting or groundbreaking, or an event at a farmer's market, that might be a great human interest story. You could try to get that on local access TV. So just, again, this really draws upon thinking about who are the partners that you have established relationships with and trying to leverage that partnership for some free media time.
Yeah, I'd also like to say that success breeds success. So as you know, yesterday they announced the second cohort of coalitions, and that press release went out, and we announced all of the new coalitions. And so any of the coalitions that are in cohort 1, it would be a great opportunity for you to go ahead and announce that you're part of this initiative. You're in the first year and a whole new group is starting. So you can promote the work that you're doing through also promoting other coalitions' works. So there are ways that you can have other success breed success for you. I have one other question, but before I ask it, I'd also encourage people, if you have a Twitter account or a hashtag that you do use, go ahead and type it in the chat box just so that we know what it is, because it's to the right. If you don't have questions, let us know what your hashtags are. That would be great. Mike, I have a question for you. Aligning strategies is a really important way to build community trust, and it's part of getting buy-in for sustainability. I'd really like to know what strategies you used to connect specifically to connect the Mayor's Healthy Richmond campaign and the Mayor's Anti-Poverty campaign, and how you got buy-in to those strategies to help with sustainability.
Sure. So with the Healthy Richmond campaign, it was actually very well aligned because the recommendations from the Blue Ribbon Health Policy Commission were implemented through the Healthy Richmond campaign. And our team member from city government was the lead in implementing the Healthy Richmond campaign. And so she was really involved in both aspects of the broader recommendations through the campaign, as well as on our team of implementing health and all policies. And so they have a periodic newsletter and information around health and all policies was included in that. And then as she worked with other parts of city government to implement the campaign, she would tie in the health and all policies framework to that as well. And then in terms of the Anti-Poverty Commission, we actually sat down with the new director of the Office of Community Wealth Building, which was created to implement those recommendations, and with the lead member of City Council who chaired the task force that developed the recommendations, and had a conversation with them initially about the work that we were doing and how it related to poverty reduction and how the principles of health and all policies around working collaboratively across sectors, around increasing efficiency and collaboration could be valuable, as well as a framework for thinking about how all city departments could focus on poverty reduction. And eventually, once that office became staffed, the lead analyst in that office joined our team and has been a part of the team. And so collectively, as we've been developing the two-day workshop, she has been very integral in thinking about how that ties into the poverty reduction work, and the presentations and the work and the case studies will all think about both health and poverty reduction together. And so we really tried to find ways to integrate those. Her office is also paying the cost for the training that will take place. And so it's just, I think, worked out really well in that both we all kind of see the same vision and how everything interacts. And again, I think recently with our discussion around wealth and all policies is just another way that we've tried to seamlessly integrate the health and all policies framework into that priority area.
Fantastic. Well, thank you all so much. We don't have any other questions, so we're actually ending a little bit early. This webinar was recorded, and it will appear on the Plan4Health website, so it will be archived there. For additional information, you can contact Institute for Public Health Innovation, Evelyn Kelly. The PG County Food Council information is on the website as well, and there are other references available for you. Thank you very much. Have a great day.